Welcome to BW Healthcare World. Today is World Health Day, and today we'll be talking about non communicable diseases, or better known as NCDs, and how they are one of the biggest public health challenges, not just faced by India, but the world over. Now, as per the WHO globally, NCDs kill about 41 million people each year, which accounts for 71% of all deaths in the world. When we come back to the figures back home, around 65% of all deaths are attributed to NCDs. WHO in 2015 in a study said that nearly 5.8 million people die of NCDs each year in India. Currently, the experts believe this number to be quite high as the lifestyle changes and the changes in the modern era have attributed to more number in the NCDs. Now, to talk about on how to best deal with non-communicable diseases and how India Inc. can strategize better, manage better, and reduce the stack of non-communicable diseases, we have two guests. We have Dr. Anupam Sibal, Group Medical Director, Apollo Hospitals. We're also joined by Dr. Sathya Sriram, CEO, Preventive Health, Apollo Group. Now, without further ado, let's just get into the thick of things, and I'll address my first question to Dr. Sibal, uh, if you allow me. Uh, Dr. Sibal, tell me, how would you define NCDs first of all, and how many people, according to you, are affected by it in India? Which are the most common diseases, and what are the major risk factors?
Namaste. It's a privilege to be a part of this interaction with you, Shivam. Thank you so much for the invitation. To put this in simple terms, non-communicable diseases are diseases that do not have an acute infectious trigger. By definition, they are chronic, which means that they have an impact over an extended period of time, going over years to decades. And typically, they have consequences which can be quite serious in a significant proportion of these diseases. There is a genetic predisposition in some of them. A lot of them are related to lifestyle. They are very related to personal habits, also what the environment has to offer. Non-communicable diseases, in the last couple of decades have become very important for us in India because, historically, for us, infectious diseases were more important. And infectious diseases were responsible for more deaths than non-communicable diseases. But what we've seen is that the trend has now reversed, and it's non-communicable diseases, and they are responsible not just for deaths, but they're responsible for a lot of ill health. They're responsible for a lot of absence from days from work, and have a huge cost impact because it's not just the health of the individual, but it does compromise the finances of the family, and it's a huge drain. And what is really sad is that most of these conditions can actually be prevented if only we gave enough thought to what causes NCD and what is our responsible as individuals, what is our responsibility to our family members. Because let's see, if someone in the family gets unwell because of a non-communicable disease, the impact is just not on that person, it's on the entire family. So I think it is really incumbent upon everyone, each one of us, to start thinking more seriously about non-communicable diseases because they have a huge impact. Now, you asked about what are the common conditions that we see. Hypertension, huge problem. And we have to realize that most people with high blood pressure will not be aware that they have high blood pressure because they're not going to have any symptoms. And most people will not get a medical check done. And because they haven't got a medical check done, they haven't got their blood pressure measured, they have absolutely no idea that they're hypertensive. And this goes on for years, decades sometimes. And then when you have the consequences on the heart, you have consequences on the kidneys, you have a predisposition to a stroke. And sometimes, it is when someone gets afflicted with a stroke that it becomes clear that this person has had high blood pressure, which is responsible, and that perhaps would have gone on for decades. The next problem that we see is cancer. And cancer, we've all seen the incidence of cancer increase. Again, a significant proportion of these cancers are preventable through a variety of strategies. We also see diabetes. And diabetes, as you know, is one condition that has an impact on multiple organ systems. So it's a disease that initially, while people feel that they need to control the sugar, they don't quite often realize the impact it has on the eyes, on the blood vessels, on the kidneys, on so many different aspects of normal functioning of a human body. And then, of course, we also have a problem with chronic lung diseases. So these really are the large chunk of non-communicable diseases that we encounter. You've shared the data that we have from the WHO in India. So it's a huge problem. And we need to recognize this problem and understand that what we see is just the tip of the iceberg, because many of these conditions have absolutely no clinical presentation, and so they get ignored and the diagnosis gets delayed.
Right. There are also cardiovascular diseases which are the part of the NCDs, and heart attacks. It's just, it's all in the media right now that the heart attacks, maybe celebrities are getting it, influencers are getting it, normal people are getting it. I talk to cardiologists. They say that they are seeing these cases in much more numbers at this moment than they've previously seen. So we are seeing a shift in these NCDs, and with the heart attacks we have a lot of other maybe reasons related also. But moving on to my next question, are there any trends that we are seeing in these NCDs, Dr. Sibal, in the sense that are we seeing an upward trend in some diseases, or are we seeing some downward, or some progress has been made in some of them?
Shivam, I mean, I wanted to talk about cardiovascular separately because it is so huge now.
Yeah.
So I'll just spend a couple of minutes on cardiovascular, because we see the impact of cardiovascular because, when someone comes in with a heart attack, that it can be pretty devastating, especially, if a primary angioplasty is not possible or is not done, then a part of the heart muscle dies, which of course has its own consequences on the contractility of the heart and what it does to you long term. So cardiovascular health is something that needs special attention, because we know that we as Indians have a higher risk of developing cardiovascular disease at a much younger age. We also know that, what we see in individuals in the 50s and 60s, we tend to see now here in the 40s and 30s, and sadly even less than 30. I mean, we are seeing individuals come in with cardiovascular problems. We've also, I think, like you rightly said, Shivam, that there has been the issue of celebrities or influencers just having a sudden cardiac arrest, which is due to a massive heart attack, and which then gives media attention. The sad thing is that even though cardiovascular disease, and I have to say after that cancer gets some amount of media visibility, it's still not enough, because what happens is you talk about it for a few days and then, then it just disappears. And that's something that we need to focus on. This needs to be a part of the narrative now. Now, to the question that you asked about, are we seeing a downward trend in any of these NCDs? And unfortunately, the answer is no. It's all up and up. And as Sathya, my colleague, will share data, and we have data on 561,000 preventive health checks in terms of the trend that we have pre-COVID. And then, of course, even during COVID, we did a lot of preventive health checks, though, of course, the numbers have come down. And of course, in 2022, the numbers have gone up. So, she will get into specifics in terms of 561,000 preventive health checks, but we are not seeing a downtrend. But what we are seeing definitely in terms of an upswing is related to obesity. Now, that, we in India have a serious problem with obesity now. But what we've seen post-COVID is that because of the fact that people couldn't go out, because of the fact that people were sitting at home, there was work from home, or the routine went away. So there was a fair amount of eating practices that one wouldn't consider healthy that really became very popular. That, in addition to lack of exercise, a totally sedentary lifestyle, has shown in an increase in the patients with obesity. And that, as we know, has consequences, whether it's the liver, the heart, the problem with dyslipidemia, diabetes.
A lot of comorbidities have
absolutely
come with.
And COVID also highlighted one important fact, which was that when we looked at the need for hospitalization in those who got infected with COVID, if you had comorbidities, higher the chance of hospitalization. Now, if you look at the cohort of hospitalized patients and who ended up getting into the IC, If you had comorbidities, the likelihood of getting into the ICU was higher. And
Right.
sadly, there was a direct correlation between the number of comorbidities you had, and this went up significantly if you had three comorbidities when you had COVID. And that's when really people realize that being healthy is important, because two individuals, one absolutely healthy, one with comorbidities, gets the same SARS-CoV-2 virus infection, and the manifestations, hospitalization, and consequences were very different. So at least people started talking about risk factors, talking about comorbidities more than they had before.
Right. Let me come to you, Dr. Sathya. Dr. Sathya, tell me, we are seeing this trend now of preventive health checkups. We are seeing the demand side from the public itself. They're coming forward, they're doing these health checkups, and so do we have some preventable approaches to go about and tackle NCDs with?
Yeah, Shivam. Firstly, it's a privilege to be here and talking to business world. Thank you so much for the opportunity. We are seeing an increased demand. Last year, second half of last year versus second half of this year, we saw, for example, an increase of 35% in the preventive health checks that across the Apollo system. And the preventable approaches, at least we think, have to be around three areas. The first is individualization. Each one of us is different. We have made different lifestyle choices. We have different genetics, and therefore our risks are different. And we have developed a predictive engine based on our 40 years of experience to determine what you should be tested for based on your risks. So, for example, people who intensely exercise, we've ensured that we've added heart health diagnostics into their package. For people who are women who are greater than 40, we know that in India, the average median age of breast cancer diagnosis is less than the Western world. So anyone greater than 40, we add in mammograms. So we've actually tailored, based on lifestyle choices as well as one's genetics, the individual package for you. The second aspect is predicting the future. So if you were to continue on the same path with no shifts, where would you end up? How many years before you are in the emergency room or have diabetes? We've developed AI-based predictive risk scores that the doctors can help you interpret. What happens if you do nothing? And then the third part, most of these are behavior modifications that are in our hands. In addition to the weight gain and the cholesterol abnormalities that we're seeing, we are also observing that sleep and stress are becoming big indicators and also exacerbating some of the chronic conditions that we're seeing. So taking a holistic view on our behaviors and our lifestyle, and making sure we stay on track to lose that 10 kilos, or to commit to the 3 minutes of meditation every day, is one of the things that we are trying to incorporate into our preventive health programs.
Right, right. Can you share with us the data that Dr. Sibal talked about in terms of the preventive health checkups? And
absolutely. So we essentially looked at about roughly 560,000 health checks that happened in the last year and compared it to 2019. If you take two of the early risk factors, obesity, weight gain, and cholesterol abnormalities, we see actually a significant increase between 2019 and 2022. So obesity went from 8% prevalence in 2019 to 12% in 2022 over a very short period of time.
right.
Dyslipidemia or cholesterol abnormalities went from 32% to 38%. Now, these are early risk factors for the downstream diabetes, cardiovascular disease conditions, right? And so taking cognizance of these is really important for us. The other thing we did is looked at geographic variation. And we found that different NCDs are more prevalent in some geographies versus others. And it comes down to sort of our cultural habits as well as our diets. So for example, cholesterol abnormalities much higher in the north than in the south. Diabetes much higher in the south than the rest of the country. And so our approach is also got to be tailored to the individual regions and our individual diets to make the shifts that we need to see.
Sure, sure. Now, let me come back to you, Dr. Sibal. Dr. Sibal, pollution is a major risk factor, and over the years, we have seen its effect in lung cancers. We are seeing its effect in COPDs. We are seeing it in asthma. Today, although we have made some, I wouldn't say progress, but a year before we were the fifth most polluted country. Today, we are the eighth most polluted country. The figures came recently. But we still have 39 cities out of the top 50 polluted cities in the world, with also no major plans or effective policies in place to reduce it. How big of a challenge do you think this will pose in adding to the numbers of NCDs?
Well, I think it's going to pose a significant challenge because, at the end of the day, when we talk about pollution, we have to look at that, what constitutes our body. It's the food we eat, the water we drink, and the air we breathe. Actually, all three are very important when we talk about pollution. So I think there's been a significant amount of discussion of late on air pollution, and we've seen that especially in the north when the air quality index really increases considerably for the winter months, and it kind of tends to become a part of the newspaper every day in terms of the AQI. Well, there have been certain measures that have been put into place, but clearly all of us need to do a lot more. We need to do more as a society. We need to do more as a community in terms of what is it that we can do as every individual over and above certain major policy implementation issues that we have when it comes to air pollution. We also have to address this issue of water contamination, because that also has a huge amount of impact on several diseases. Now, while water pollution, with contamination has issues with largely infectious diseases, but if the water that you're consuming has higher elements of certain minerals, that over a period of time also has an issue in terms of how it impacts your health. And we also have this issue about the food in terms of what exposure to insecticides that we've had, which also over a period of time could have an impact in terms of how a disease pans out, or what happens to the manifestations of the disease. So I think it really boils down to looking at the environment as a whole, and pollution definitely needs to be addressed. And when we talk about the environment as a whole, we also need to look at what each one of us is doing in terms of modifying some of the risk factors. So environment is one, but what is it that we are doing in terms of contributing to adding on to the pollution? And that is also something that needs to become a part of the narrative. And I don't think much has happened in that direction.
Yeah, in order to build that narrative, do you think there has to be a push created from the the general citizens, the public itself, and that will eventually lead to policy change? That change first, or that narrative has to set in among the citizens itself first?
Well, absolutely. I think we need to talk about it, whether it's in the medical community or the community at large. We need to start talking about these issues, which I don't think we've talked as much as we should have. And talking about community participation, I think one important aspect that we must address is that, and typically in meetings where one is interacting with non-medical colleagues, I tend to ask this question. I said, everyone out here has a vehicle, right? And then I said, when was the last time you got it serviced? And everybody in the hall says, yeah, I got it done 6 months, 1 year. And I said, when was the last time you had a health check? And not going and seeing a doctor when you're unwell. And that obviously people do. But when was the last time that you actually went to a doctor when you were feeling fine, and not more than 10% of the hands go up? So I think it is important for each one of us to realize that our health is in our hands. And this whole thing that it won't happen to me, it's happened to someone else because of this or that. We need to understand that there might be risk modifiable factors that we would not be aware of, that we need to address. For example, if your cholesterol is high, it's going to be sitting there without you knowing. And if somebody measures your lipid profile and then the physician tells you, listen, your lipid profile is high, this is what you need to do to correct it. Do that now before any consequences emerge. The similar thing with high blood pressure and some of the dietary habits we have, like eating a huge amount of salt, which of course, world over there is a campaign to cut down on salt, but I think we love our salty snacks and so on and so forth. So we're not doing that. This whole thing about sugar and the way we consume sugar and the way we consume fat, the amount of butter that we consume and the cheese that we consume. So, these questions need to be addressed, and it's not something that should be ignored. So, our personal responsibility, getting a health check done, and not worrying about what will be found. If something is found, then it will help prevent a disease from emerging. And if you're fine and that's fantastic, then carry on with that lifestyle. And so both ways you gain actually. So there isn't really a downside to getting a health check done. So we need to change our mindset towards health checks.
Right, right. Dr. Satya, are there any preventive measures that one can take to reduce one's exposure to pollution?
So, well, I think the COVID taught us that masks are a good thing in general. And I think getting into that habit, especially during the high pollution months, is not a bad thing. We now know we can actually survive for long periods of time behind a mask, and it's okay to do. And then there are other devices, air purifiers, and so forth. I do think that there are two others. One is, in general, we as citizens must take charge and have more discussions around this, as Dr. Anupam just mentioned as well, carpooling, taking the metro, lots of things that we individually can do to cut this down. We should do more of that and encourage the next generation to do that. But I think more importantly, we are living in the world that we are. Testing your lung function is a priority, whether it is through a pulmonary function test, even as simple as blowing a balloon and making sure your lungs are functioning properly. And a doctor actually sees that and gives you a certificate of good lung function is important. And I think that's something that is very much in our hands as well.
Right. So let me come back to you, Dr. Sibal, once again. What are the big challenges as per you that India is kind of facing when it comes to tackling the rising stack of NCDs? I'm talking about the administrative infrastructural setups now. How do you think the implementation of NPCDS, DCS, the government's the plan for non-communicable diseases is working out? And how do you think India can strategize better to implement its goals?
Well, I think, the program started several years ago, and NCD clinics were established in 700 districts. And while people will get sort of the correct advice when they go to a clinic, what we need is really a movement on a national scale, which really talks about healthy lifestyle. If you recollect that for cancer, the danger signs, if you've lost weight or there's a change in a mole, or if you had cough for an extended period of time and so on and so forth, but people started thinking about cancer. Like that, we need to have a set of of actionables for each individual that we need to articulate at every possible opportunity. Use social media more effectively, use the print media, the electronic media, what have you, in terms of communicating that. For example, tobacco, such a big problem with cigarette smoking, with chewing tobacco. And there needs to be a bit more. I mean, we've seen that with movies and everything about ads coming in, but this needs to be enhanced. Sugar is a big problem, and we don't seem to be taking that seriously. Similarly, salt, the impact that it has, you shouldn't really be adding salt, and we have this habit of adding salt all the time in India. That needs to be addressed. Simple measures in terms of like 40 minutes of exercise 6 days in a week, and there are 1,000 reasons why you can't exercise. Each one of us can come up with excuses, but honestly, 40 minutes of a walk requires nothing. It requires no infrastructure. It just requires a mindset. It requires a commitment, and it requires someone to tell you that, listen, it's one of the most cost effective, most useful ways of actually keeping yourself healthy. We have a festival in India every 5 days. You know that. Proper big festivals. if we count all the festivals. And every time there's a festival, okay, and have an extra laddu, or have an extra mithai. Come on, it's festival time. But they really add on. So how much of this is something that we need to control. We need to start having these dialogues. Um, and as a pediatrician, I can say that I'm really, really stressed about the rising obesity that we see in young children. These habits need to be inculcated at a very young age. If you have a child who's overweight at 5, he's very likely to be overweight at 10 and 15, 25, 50, and 60. Because it's very hard to lose weight once your body's got used to it. And quite often in schools we don't see that, and I see another trend, which is about schools offering meals. The lunch is now provided in a large number of schools, and it's a buffet, so you can eat as much as you want. So if your friend eats a lot, you also end up eating a lot more than you would normally had if you'd taken a little lunch box, right? So I think we really need a campaign where we need to start talking about, eat healthy, have healthy lifestyle, exercise, get your medical check done, because honestly, the consequences are going to be very serious. So we need to talk about this at all times. The government is doing its bit, through the 1,50,000 plus health and wellness centers that have been created as part of Ayushman Bharat. And the good thing is that they're called health and wellness. So this whole concept of wellness has come in. And, the messaging is going to be very clear about wellness. But over and above that, we as every responsible citizen needs to do our bit. You also talked in your opening remarks about India Inc. I think it's very important for companies to also encourage good behavior. Encourage your employees to undergo a medical. Let them have a track of what the health parameters were last year, what are they this year, where is it that they've fallen back, what is it that needs to be actionable or actioned for that year, so that they become healthier. And it is in the interest of the company, because you won't have sick employees, you won't have employees who will take time off. So I think at the corporate level also, we need to do a fair bit in terms of assessments and follow-up.
Right, Dr. Sathya. What do you reckon? How can India Inc. Strategize better to deal with the rising stack of NCDs in India?
So India Inc. actually has a much higher incidence that we have seen, and we reported in our Health of the Nation last year. And we saw that some sectors like banking had very high stress levels and associated hypertension. They have an opportunity with their employees to engage with them about their health, give them the opportunity to actually be role models for one another. It's the natural community that we all lean on and spend a good 8 to 12 hours a day with. And so to encourage one another to actually get their health checks and actually encourage healthy behaviors. We're also doing a number of things in ensuring it's convenient for them. We're working with corporates who say, come to our campus with a health check on wheels, so we can take some of the diagnostics to their campuses. And then at least we address one of the barriers, which is I don't have time to go to a clinic or a hospital to get this health check done. Another thing we're doing is helping HR heads aggregate the data across their company and identify specific chronic programs for them to actually go deeper on and work with their employees on. So there's a lot that India Inc. can do and must do, especially as we think about World Health Day.
Yeah, right. So, Dr. Sibal, you spoke about tobacco there. The recently in the budget also we saw tax hike, but a lot of experts came in after that and said that this tax hike is a misnomer, and the companies will eventually use it to raise the price, and it won't affect the price that much, and it won't drive tobacco usage in the country. And there you have then you have and things like surrogate marketing in the movies. You also mentioned that. So do we need a stricter kind of action from the government on these things, if you consider tobacco and other things?
One thing is what the government can do to encourage good behavior. And some of that is, of course, whether it's taxation or whether it's advertising or whether, it's making sure that incorrect information is not passed on. But I think what we also need on the other side is making the public at large realize the consequences of bad habits. We do have a very serious problem with tobacco, oral cancer. It's a very hard cancer to manage when you actually see them in stage 3, stage 4, where it's just spread. And it's not then just one modality, but you end up requiring 3 modalities. There's chemotherapy, there's surgery, there's radiation, and it really has a huge amount of economic devastation that it brings. So I think we do definitely need to encourage individuals also to be more responsible. There's only that much you can talk, but they have to realize from within the damage. And also a big concern with young people with smoking, and that's also something that needs to be addressed and tackled in schools.
Yeah, it's culturally acceptable in the young population now, that it's become the cool thing to do, and you see it the see it happening a lot. So coming to my last question, which is the message for the health day from both of you want to understand. Let me start with Dr. Sathya first. Dr. Sathya, tell me, what is your message for the viewers on World Health Day?
Health is not just the absence of disease, it's how you function physically, mentally, emotionally. And one of the things that we're doing at Apollo is actually launching Apollo Pro Health this World Health Day. And that helps captures one's individual status, predicts potential health risks, and individualizes every single health check. So, this World Health Day, my message out is to be pro health.
Dr. Sibal, you.
So Shivam, my message would be very simple: is that please think about your own health, because it's not just for yourself; it's for your loved ones. If you are a working member who brings in everything that the family needs, your health keeps the kitchen going and everything else going. And if you are a lady who's a homemaker, do remember that your kids look up to you for everything. So it really is very important that you think of your own health, because on your good health depends the health of the family. So please, it's not about being selfish, because we have a lot of, and especially with women, and I want to address this to women, they always put everyone's health, everyone's needs above theirs. And that's not right. They have to start thinking about their own health and own well-being. So this World Health Day, please think about how can I be healthy, and think about your own health and what is it that you can do to make it better.
Right. A lot of things were discussed here in terms of what can be done to keep one healthy on the World Health Day. I want to thank you, both of you, for joining us here, giving your time. I know you're busy people, and you're practicing doctors, so you might have some, you know, consultations or anything lined up after this. So thank you. Thanks a lot for giving me time, and yeah, stay healthy, everyone, and stay safe. Thank you.
Thank you very much. Thank you, Shiv.
Thank you.